Sawasdee and good afternoon once again. Today is Wednesday, the 28th of April, 2021. So firstly, thank you to Dr. Apisamai for the briefing just now in Thai. Today I'll start off directly with the numbers that we have recorded for today, which is 2,012 confirmed cases for today, as compared to the number of recoveries recorded for today, which is 851. So from the new confirmed cases, 2,012 recorded for today, out of that number, 1,893 are from cases of local transmission, the majority. 108 cases are from active case finding missions, and 11 cases are from the state quarantine system. Now, as you see on screen, the cumulative number of cases in Thailand has exceeded 60,000, and the number of cumulative recoveries since the very beginning is 34,000. Active cases in Thailand still under treatment, number 27,119, as you see in the green box on top. Out of the 27,119 active cases being treated, 695 are considered to be in critical condition. Out of the 695 critical condition cases, 199 cases are cases of patients on ventilators. So actually, more than half of this number had been admitted to hospitals in Bangkok. The number of fatalities. So in the past days, we have seen high numbers in terms of fatality, well above 10 per day. For today, we have 15 new fatalities recorded, making the cumulative number of fatalities at 178. Now, these 15 new fatalities, 11 are male and 4 are female. The median age is 61. And the ages range between 35 and 88. This is for the fatalities recorded for today, 15 fatalities. And of these fatalities, we have, in terms of the provincial distribution, 9 are fatalities in Bangkok, Chiang Mai 2, Samut Prakan 2, Chonburi 1, and Ranong 1. Most of these fatalities have suffered from pre-existing conditions such as high blood pressure, high cholesterol, heart disease, and thyroid disease. And from the 15 new fatalities, where did they get infected from? The majority of them, 10 out of this 15, got infected from family members, 2 from colleagues at the office, and the remaining 3 from other types of other contacts. So therefore, it is strongly recommended to exercise extra precaution when visiting family members, especially the elderly. And just some additional observations in terms of the provinces which have the highest number of new confirmed case is Bangkok. Firstly, Bangkok with 830 cases, followed by Samut Prakan 161, Chonburi province at 108, Nonthaburi province with 71, and Samut Sakhon with 59. And you see an infographic there on screen for you. So as most of the new confirmed cases and fatalities are in Bangkok and in the surrounding provinces, the vicinity of Bangkok, the Department of Disease Control recommends people to avoid crowds, avoid gatherings in Bangkok, to avoid the further spread, and to work from home at the maximum capacity. I believe that this is already being done to the maximum possible capacity in government offices and many private sector companies already. And of course, also to exercise caution when visiting people from different households. Just additional information, an update from yesterday on the single command approach that the government is taking. As I mentioned earlier this week, that the government had adopted the single command approach in combating the current outbreak. Yesterday, the cabinet granted the Prime Minister powers to temporarily enforce 31 items of legislation to curb the spread of COVID. Now, this announcement, which has been published in the Royal Gazette, transfers the power of cabinet members to ensure efficient handling of the situation by the Office of the Prime Minister. The announcement covers 31 pieces of legislation, including the Communicable Disease Control Act, the Drug Act, the National Vaccine Security Act, and the Emergency Medical Act. All key aspects related to the prevention of the spread of the virus and treatment of the infected, including procurement, distribution of vaccines, management of hospital beds, which is very important for this time, and the imposition of restrictions to contain the disease will be in the single command approach control of the Prime Minister. The concentration of powers is only temporary and aims to ensure efficiency in the efforts to deal with the disease. So it is an approach of streamlining, approach of integrating the command and control, which is we deem as very necessary for this time. One piece of information regarding schools is that the Ministry of Education has decided to postpone the opening of the new school term in all public and private institutions from the 17th of May to the 1st of June. So for opening of schools on the 1st of June, the end of the school term will remain unchanged on the 11th of October. And the Education Ministry also emphasized that during the next month, all schools and educational personnel should prepare learning materials and other related tasks for the new academic term, as extra online activities may be required, and these online teaching methods will be very important because we need to minimize the impact on the delay of the reopening of the students. So they would have to prepare the tools and the curriculum and is set up to fit with the online learning system, and so that the children will not be missing out on any of the continuous courses that are necessary. And schools that are situated in areas of slightly affected by the outbreak may be able to provide normal lessons in the new academic term. The ministry is closely cooperating with the CCSA to assess the situation and ensure that all students will receive the best learning opportunity. On the Bangkok Mass Transit Authority, BMTA, reducing their services, they will reduce their bus services during working hours to comply with the BMA order to seek people's cooperation in working from home and avoid leaving their households. So before closing, I'd just like to present some tips from the World Health Organization. I do that once in a while, on what to do if someone is sick in your household. So the World Health Organization recommended that the sick person should be isolated in a room that is well ventilated and open windows frequently. Only one household member should be the contact person with the sick person. The contact person should not be in a high-risk group and have the fewest contact with people outside. The symptoms should be checked regularly. Contact healthcare provider immediately if the person shows any dangerous signs such as difficulty in breathing, confusion, loss of speech or mobility, and chest pain. So these are the updates I have for you today. I hope you have a very pleasant rest of the work week, and we'll see you again tomorrow. Thank you and สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพันธ์